Hello, Assalamualaikum warahmatullahi wabarakatuh. Introducing, my name is Alvan Ardiansyah. I am a student from the University of Palembang Serang. Now, I will present a nursing documentation report from the patients. In order to fulfill the task of English for Nursing 2 course. Don't linger it is, let's start. Nursing documentation report from the English for Nursing 2 course. Let's start everything by saying Bismillahirrahmanirrahim. The patient's identity. The patient's name is Dewi Sagita. She is 21 years old, Muslim and single. She is office worker and employs as a secretary. She lives on Cilegon Street, number 18. Her phone number is 05 56 78 9 and 10. Dewi's of kind is Jubaida, and health insurance is Prudential. And symptom and the dimensions. The symptoms experienced by the patients are fever, headache, stomach pain, no appetite, nausea, and vomiting. Oh, more complex, yes. Dimensions of symptoms. The patient feels pain is upper part of the stomach, pain that feels like a stabbing. Scale 8 out of 10. Happened when she finished eating a bowl of spicy meatballs. She said the pain will get worse when she eats too much spicy and fatty food. But the pain will listen. When she rests. Okay, now the healthy history. Appendicitis in 3 years ago and had surgery. The immunizations history. The patient has been immunized DPT, polio, measles, and rubella when she was a baby, but she have not received the COVID-19 immunizations. Allergy history. She has an allergy with shrimp. Assessment result. Head. There are no wounds, lumps, baldness, and the patient's head is clean. In addition, the patient is also able to move her head well. Face. The patient's face is symmetrical. There are no lumps, no wounds. The patient can move her eyebrows and frown. In addition, the patient can also open, close, and puff out her mouth. Next, nose and sinus. There were no lumps, sores, or infections on the patient's nose. The patient's nose is symmetrical, and the nasal mucosa is good. The patient has no problems with her nose or sinus. And neck. The patient's neck is able to move the neck well. Mouth. The patient's teeth, gums, tongue, and soft palate are clean, but the patient's oral mucus is dry. Purring. The patient's throat was normally symmetrical, and there were no injuries. The eyes. The patient's vision is not problematic. Eye movement are good. The eyelid can close well and the pain can close well, and the patients can raise eyebrows. Ears. The patient's ears. There are no problems with the patient's ears. The patient's ears are clean. There are no lumps or wounds and the hearing is functional well. Next, the patient's hygiene. From the body of the patient was bathed at 8 a.m. assisted by nurse because her family was returning home to pick up some necessities. The patient is bathed on the bed because the patient still complains of the headache and the stomach still hurts. There is a problem with the patient's skin. After taking a bath, the patient is smeared with eucalyptus oil. The oral. The patient's mouth, tongue, teeth are in good conditions won't. However, the patient's oral mucus is dry. The patient feels better after brushing her teeth. Okay, next, the eliminations pattern. From the defecations, the patient has not defecate. The urination is assisted with a bedpan. On the bed, the patient's urine is slightly cloudy yellow. Alright, and next, injection therapy. The patient was given IM or intramuscular ranitidine at a dose of 2 ml twice a day to reduce stomach ache. And IV therapy. The patient was given IV dextran therapy of 500 ml for 2 hours to prevent dehydrations, and paracetamol 1 gram for 15 minutes via infusions every 4 hours, which aim to reduce the fever. Okay, next, the lab sample from the patient's Dewi Sagita. Lab sample results. Blood. The result of the blood examinations showed that the hemoglobin decreased due to bleeding in the stomach and feces. Stool examination has not been carried out because the patient has not defecate. And urine. The urine examination is not performed on the patients. And last is sputum. Stool examination has not been carried out because the patient has not defecate. And thank you. Assalamualaikum warahmatullahi wabarakatuh.